Psychological disorders affect millions of people worldwide, influencing how individuals think, feel, and behave. Understanding these disorders and their treatment approaches is crucial for advancing mental health care and breaking the stigma surrounding mental illness. Today, we'll explore the types of psychological disorders, the frameworks for understanding them, and the treatment options available. Don't forget to visit kotc.me and join us at King of the Curve for more insights and resources to master this topic. When discussing psychological disorders, two primary frameworks stand out: the biomedical approach and the biopsychosocial approach. The biomedical approach focuses on the biological roots of mental illness, such as chemical imbalances in the brain or genetic predispositions. Treatments within this framework often involve medication or other interventions targeting biological factors. For example, antidepressants like SSRIs are commonly used to treat depression by balancing serotonin levels, while antipsychotic drugs can manage dopamine dysregulation in conditions like schizophrenia. In contrast, the biopsychosocial approach recognizes that mental health isn't just about biology, it's a complex interplay of biological, psychological, and social factors. This framework considers how thoughts, behaviors, and external stressors interact, tailoring treatment to address these diverse influences. Treatment for psychological disorders often involves direct therapy and indirect therapy, each serving a distinct purpose. Direct therapy focuses on interventions acting directly on the individual, such as medication, cognitive behavioral therapy, CBT, or regular counseling sessions. For individuals with severe conditions, direct therapy provides essential tools for symptom management and recovery. Indirect therapy, on the other hand, aims to build a support system around the individual. This might involve family counseling or educational sessions for friends and loved ones, empowering them to create a nurturing environment. Together, these approaches provide a comprehensive strategy for addressing the complexities of psychological disorders. Diagnosis is a critical first step in understanding and treating psychological disorders, and the Diagnostic and Statistical Manual of Mental Disorders, or DSM, serves as the gold standard for mental health professionals. The DSM categorizes disorders into 20 diagnostic classes, providing a common language for clinicians to describe symptoms and identify appropriate treatments. For example, diagnosing generalized anxiety disorder involves identifying symptoms like persistent worry, restlessness, and fatigue, all outlined in the DSM's criteria. Although the DSM has faced criticism for sometimes oversimplifying complex conditions, it remains an indispensable tool for mental health care and research. Let's bring this all together with a case study. Meet Sarah, a 32-year-old diagnosed with major depressive disorder. Her symptoms include low mood, loss of interest in daily activities, and trouble sleeping. A biomedical approach might involve prescribing an SSRI to balance her serotonin levels. However, her therapist also uses a biopsychosocial approach, helping Sarah identify cognitive distortions through CBT while addressing stressors in her work environment. Direct therapy helps Sarah manage her symptoms, while indirect therapy strengthens her support network, involving family members in her recovery journey. Understanding psychological disorders is crucial not only for clinical practice, but also for acing the MCAT psychology and sociology section. Questions often test your ability to differentiate between the biomedical and biopsychosocial approaches, or analyze how therapies address specific conditions. To prepare, familiarize yourself with the DSM structure, practice analyzing case studies, and recognize the interplay between direct and indirect therapies. Knowing these distinctions can make all the difference on test day. To recap, psychological disorders are complex and require nuanced approaches. The biomedical approach focuses on biological roots, while the biopsychosocial approach considers the interaction of biological, psychological, and social factors. Effective treatment often combines direct therapy, like medication or counseling, with indirect therapy, which builds a support system for recovery. Finally, the DSM provides a critical framework for diagnosing and understanding these conditions. By understanding these approaches, we can better appreciate the importance of mental health care and the multifaceted nature of psychological disorders. Thank you for joining us today. For more resources on psychology and MCAT preparation, visit kotc.me and explore how King of the Curve can help you excel. Together, we'll conquer the curve and achieve your goals.